So if you want to ask me questions about technical dentistry, I will answer them. Some of my cases are going to be shown, because the original title of this presentation was, what boring title did they give us to give? Maximize aesthetic something?
Yes, Max, you got me on the spot here, but something about.
Interdisciplinary, big words, interdisciplinary treatment and all of that. And so, you know, I'm not big into that kind of stuff. I'm more big into how I'm going to live my life and bring dentistry into my life. That's what I've been about for 40 years. Because I don't know why you became a dentist, but I became a dentist to improve my life and to live a good life, whatever that means. We all have different definitions of what a good life is. I'm not going to tell you what that is. But I know one thing, I wanted to live a good life, and that's why I chose dentistry. And so we renamed this, you have to click on it.
Oh, let me get you a clicker.
So we renamed the title of this lecture, instead of like long technical term, we call it What Got You Here Won't Get You There. Now the thing is, wherever here is here. Wherever you are right now, dental school doesn't really make a difference. You're going someplace. You've all read the Dr. Seuss, you're going places. Wherever it is you're going, whatever it is, you're going to need more skills. And they're not only going to be skills that require you to do a root canal or place an implant. Okay? And so after, do the math, 42 years of dental practice, I added a subtitle, The Sacred Professional Journey. Because it's a journey, and you're at the beginning of it. So when you graduate, how many fourth year students here? So when you graduate, the sole graduating student, you will be really birthing a new career for yourself. And the third year students have time, and the second year students, and the first year students. But you're going to enter a journey. And so the one thing, so I was thinking about, how do I tell that story about that? So as you, anybody know him? Just you. Chip Kelly. Everybody know Chip Kelly? Show of hands. The ex-Philadelphia Eagle coach was just fired. Does anybody know why he was fired? Go ahead, tell me. He ruined it. That was the result, okay? But the owner, Jeffrey Lurie, gave a specific reason on the day he was fired. He said he lacked people skills. He couldn't relate to his players. And so they were going to go out and find a coach that could relate to his players. So I saw this slide, and I said, how did this successful coach in college, University of Oregon, #1 coach, I don't even know if he even actually won a national title, but he was very successful in college as a coach. How could this nationally recognized coach, who was so good at the X's and O's of football, fail when he got into the professional world of football? How did that happen? Well, Lurie gave us a hint. He couldn't relate to people. But then how did he succeed so well at Oregon? And the answer is, at Oregon, as a coach, he was a positional leader. He led by position. Basically, he said, you are the coach. These students will listen to you. That didn't happen outside. You're the coach in the professional world. These are your players. And guess what, coach? You're going to have to earn the right to lead. You're going to have to earn the right to get their attention. You're going to have to earn the right for them to do what you're going to ask them to do. And isn't it interesting? I may be the first person to ever tell you this. So remember, most of you, and including me, when I was in 1969 coming into dental school, persuading people to do things was the furthest thing on my mind. As a matter of fact, if I had known that I was going to choose dentistry and that would be a major part of my job, to be a leader, I may not have chosen. I may not have done that. Because I abhor that. I don't want to go around convincing people to do things that are good for them. And guess what? That's going to be your job when you get out of here. Every single day, you're going to be persuading people and talking to people and relating to people and getting them to do things that are good for themselves, because that's the only way you're going to get your skills off of the shelf. All the skills that you're learning, whether it's endo, implant, terrorism, the very best of the students, in order to get your skills off the shelf and into the mouths of your patients, are going to require other skills. Skills of leadership, skills of communication. And so, recent studies have shown, and this is not just dentistry, recent studies have shown by the Gallup people, the people who poll people, that worldwide, at work, in today's world, only 17% of people are engaged in their work. Think about that for a second, through the eyes of a dental student. Are you kidding me? I spent my whole life and all my parents' money to get into the situation where I'm not even going to be engaged in what I do, unless you make yourself engaged. Easier said than done. Easier said than done. Because it takes a lot to stay focused on your work to the point where you really like it. You're probably feeling negative right now, aren't you? I hear stories about dental school and medical school these days. I was telling Ross on the way here, my 4 years at Penn were the best 4 years of my life. But I hear stories of dental students today. I hear stories of medical students today. They don't look at medical school and dental school the same way. There's a lot of stuff going on that I won't even talk about, that they're saying that their experience in school hasn't been that great. And that's where a lot of problems begin in the dental schools, that they're not being trained to deal with the outside world. But this is a Gallup poll, and this is a poll that a lot of people refer to, that only 17%. So that's a goal. Let's not be one of the disengaged. Let's be engaged in what we do when we get out of here. I told you this was going to be a little bit of a different lecture, because this is what it's all about. It's all about climbing a mountain. It's all about that journey. And you've got to define what that mountain is. You've got to define what success means to you. It's individual. And so, I'm going to refer to, in a little while, I'm going to refer to a dentist who was a big influence in my life. His name was Dr. L.D. Pankey. Has anybody ever heard that name? Yeah? And so, the majority haven't. So through the day today, I'll mention Dr. Pankey's name, and I'll describe who he was in a second. But basically, Dr. Pankey was a dentist who practiced in the 50s and the 60s, and as a tribute to him, a lot of his followers built an institute down in Key Biscayne, Florida. And what Dr. Pankey taught his students back in the 50s and 60s was how to apply a lot of the things in dentistry, technical as well as behavioral, to reach a point that he called happiness, for lack of a better word, happiness. In today's world, that word doesn't mean much anymore. It actually has lost its meaning. But in reality, the psychologists have taught us that what Dr. Pankey was really talking about was a concept known as well-being. And you know, we're right here at the University of Pennsylvania, which is the heart of this whole positive psychology movement that defines well-being. Does anybody know Dr. Martin Seligman from the University of Pennsylvania, right here in the psychology department? He is the father and the founding father of the movement of positive psychology. And basically, what he has done over the last 10 years or so is he has defined this word happiness and what it means. And what he's defined it as is many different components. It's not just one single component that means pleasure, like get me a pizza and I'll be happy. You see? Happiness has more to do with other different components. And Dr. Pankey, he basically codified a lot of these things. So I use this simple symbol of what he said it was. He said it was know yourself. Who are you? Big question. Who are you? Know your patients. Who are they? Know your work. And he didn't only mean the technical work, he meant also the behavioral component of the work. And then apply your knowledge. That's the work. That's what you need to do. In the center, now he did it in the form of a cross. But in the center was that one spot. That one spot is what Pankey called happiness. That one spot is what the positive psychologist here at Penn, Seligman, would call well-being. I like the well-being term because it's composed of a lot of different components. When they asked Freud what was happiness, he said two things: work and love. Work and love. And then years later, when Seligman came along, he said, you need to balance more than work and love. He said, you have to have some play in there too. A little Bikram yoga wouldn't hurt sometimes. I do Bikram, he does it. Anybody do Bikram yoga around here? All right, good for you. We'll do a few postures after this. Work, love, play. And the other thing that he said was worship. He used the word worship. Well, you know, we live in a very diverse world, and that word worship can mean a lot of things to a lot of people. So I never, that word didn't sit well with me back in the 80s when I was listening to Dr. Penn. And it doesn't, and worship means a lot of things to different people. The positive psychologists do acknowledge the fact that religion does play a role in the person's well-being. But another word that I like to use is service. Instead of religion or worship, I like to use the word service and understand that in order to have a sense of well-being in what we do, we have to do it within the context of other people. That everything, we have to be our best selves for the sake of other people. Boy, that just tiny little piece of advice is going to go a long way in your day-to-day work when you're out here. Even in here, and realize that you're not here for you. You're here for them. You're not here to get out of this clinic today that passes away. Do they still do it the same way when I was here?
I've been here for a
You
while.
have to get checked off, whatever procedure you do. God, haven't changed that in 40 years. So. Anyway, that's what, I mean, I'll be honest, that's what I did it for. To get checked off and get out of here. And go over to Billy B's and have a hoagie.
They don't have Billy B's
I know
anymore.
they don't have Billy
Okay.
B's. Billy B's is right across the street where the subway is. But the point is, when you change your mindset to the fact that you're here for them instead of here for you, it makes a big difference. And it's one of the components of your own happiness and your own well-being. And basically what I'm saying is, during the course of this day, and we'll get to teeth. I know dentists really get off on teeth, okay? Have an open mind about some of the things I'm saying. Have an open mind. Yesterday was my birthday. And my wife gave me a card. And she says, something on the card says, boy, you're really old school. And I am old school. And I always believe that old school is good school. I really believe that. And the further I go into the future, the more I'm proud to say that I am old school. You know, and I hear a lot, you're all millennials, correct? I hate to be grouped into that thing. Okay, but the bottom line is they tell me that millennials are beginning to look at the old school and say those values of the old school are really what's going to bring us into the future. Because the values that you've been left with today are not very good. And that's what you're seeing out there today. So, when you leave here today, if you want to touch me, I may be the last vestige of old school that you'll see in a long time. Okay. Basically, we need to pick a direction. You're all sitting here. I know Ross asked you what you're going to do when you get out of here. And basically, a lot of people don't know what they're going to do. I think one of the things, you know, is not only to find a vision of what you're going to do. Okay, that's very difficult to say, you know, what's your vision? Everybody asks that question. What's your vision? What's your vision? How do you know what your vision is? You haven't, you know, still in dental school, you don't know your vision. But that's not what's important. What's important is to find your direction. That's important. And that's determined by what you value. What are your values? Who are you? Where do you want to go? What direction? Because you're not going to end up where you thought you would. And then I always like this picture because who are you in this picture? Who are you? Anybody want to take a guess? That's a band. Everybody has a part to play. Who are you? Take a guess. Someone.
Director.
Yes, you're right here. You're the leader. You're the orchestra leader. That's what I charge you with all here today as Penn Dental students. Not to be a dentist, be a leader. Be a leader. I'm going to tell you, being a leader is hard work. It's hard work. It's taking everything that's on her mind, or his mind, and making music with it. One note. Polysymphony coming out one way. That's what leaders do. Now let's talk about Dr. Pankey for a second. And so, you do know who Dr. Pankey is. You've heard of him. Okay. Dr. Pankey was, and I don't know the names of, there are people on these walls that come out. People who built Penn for years. D. Walter Cohn. Are these names familiar to you all? Are they still?
Yeah,
D. Walter Cohn, Gordon Amsterdam. You see? Lester Burkett. Okay, these are old deans. J. Siegal. Okay? I knew these men personally. Okay? And Pankey was a colleague of theirs back in the 50s. You know, when that community of really good dentists got together in Chicago every year or in New York to meet. And so they would share ideas. And so Pankey, what he did, what made him different, was he began to look at the human side of dentistry. And so this was his, whoops, let's go back. This was his famous quote. And remember it. I never saw a tooth walk into my office. A tooth is a component of what we do. And the mission of the Pankey Institute was to narrow the gap between what is known and what is felt. When you get into the real world, as you say, you're going to see every single day patients come into you off the field. You see it now. God, the condition of this person's mouth, it's like third world. We know more about that in dentistry. We can fix you up. We can do so much. But how come it's not done? What's stopping that? What's stopping all this wonderful technology from actually getting done, coming off the shelves and into people's mouths? See, Pankey knew that. This was the mission of the Pankey Institute, to make sure that the dentists who went down there were learning the skills needed to get the dentistry done. And so this is holism, okay? You're not being taught holism. You've never been taught holism. Most people in this world are not holism thinking. I'm differentiating between the word holism and holistic. Okay? This is not holistic dentistry. Holism looks at the whole picture. It looks at all of the components of something. So for example, there's an old story right here where 6 blind men were standing around an elephant. And they were blind and they were asked to describe the elephant by holding a piece of the elephant. So one would hold the tail, and the other would hold the leg, the other the trunk. And then they were asked to describe an elephant. And the one who was holding the tail would say, well, the elephant is like the trunk. It was like a rope. And the one holding the leg would say, it's like a pillar. But none of them would get what all the elephant was. They couldn't describe an elephant. And so what I'm saying to you is, if you take a holism approach or philosophy to your profession, to understand that dentistry is not about teeth. It's just a component of dentistry. Does that make sense? As a matter of fact, I think venture to say that you don't even know all of the components of dentistry. The psychology, the behavior, the science, and the dental part too.
Do you want to just finalize on how people used to say to you about asking for marketing pros? You mentioned me the other day.
Yeah. When you leave here, one of the biggest things will be for you to try to get patients. How am I going to get patients? You know, when I started practicing back in the 70s, we used to see. And by the way, I should have defined this before. I am a fee-for-service private practitioner. I am so rare in the dental community these days, it's not even funny. Are you familiar with the term fee-for-service private practice? As differentiated from the rest of the dentists, who are basically working for some third party. You see? So what that means, and I accept no dental insurance. Zero. None. My name does not appear on any list anywhere. So whatever marketing I do to bring in new patients is strictly old school word of mouth. How do you do that? How do you do that? That's marketing. And so that's a struggle because marketing changes and everybody has their own idea of what marketing is, you know, or advertising, or phone books, and all of these things that you can hear about. And so many years ago, I read a book called Marketing Myopia by a man by the name of Ted Levitt, who at that time was the president of the Harvard Business School. And he wrote a book on marketing. And I'll never forget his definition of marketing. Write this down if you want to take notes. Marketing, as defined by Levitt, is the creation and the maintaining of relationships. I say, wow, how simple is it? How simple is it? And if all of my marketing was geared to creating the relationships and maintaining the ones I had, all of a sudden word of mouth looks a little different. And that's how I've been marketing for the last 30 to 40 years. Now, when you leave here, you're going to hear a lot of things about marketing. They're going to tell you about SEO. And they're going to tell you about being first on Google. And those things may work. But they're just tips, and then they may not work, because what's tomorrow's news? Well, what's timeless and what's ageless is relationships. And so that's my marketing advice. And so I'm going to give it off to my colleague here, and he's going to talk about his game plan.
Okay. So, you guys can hear me okay? I remember sitting exactly where you guys are sitting now, in B13, when I was in 1998, when I was graduating. So unlike when Barry was here, you know, when you were here, this was just a patch of grass, right? So,
Nothing here.
Nothing here. So they actually had this room, you know, and I remember being here and kind of being very nervous what's going to be out there. Because people are saying times are changing. You know, I still want to open up my own practice. Corporations were already starting to take over at that time, and all these third parties were coming in hiring dentists. And we were hearing all these stories how, you know, you end up practicing not necessarily for yourself, not always for the best interest of the patient, but more so for the interest of the corporation. So I didn't want that. I really want to open up my own practice. I worked as an associate for just a little bit before, and then I just decided to hang my shingle. So in the beginning, it didn't work out great. I want to be honest with you. So you're going to learn from my mistakes today. And I remember working out at the gym, and that's where I saw Barry one time, and I was telling him about all these marketing things I was going to do to get the practice going. So first I thought, you know what? I'm going to build a beautiful office, because I was in a very saturated area, because I wanted to work where I want to live. I want to be in the same place. I mean, that's a nice goal I still recommend to you guys, wherever you want to be, first decide where you want to be, and then that's where you should be practicing. So I built a nice office. I really did it up. 3,000 square foot office, because I felt like, you know, just like the movies, You know, if you build it, they will come. But it didn't exactly happen that way. And so here's, you know, our office right from day one. Took out a $500,000 loan, okay? And then we got the best technology, all the bells and whistles, the marketing. We put ourselves in the newspapers, and I remember showing this to Barry, and he'd just shake his head. But I was pretty excited. I was like, you know, I'm gonna do this. It's gonna work, because I was very optimistic. We had our ads in papers, we paid for these ads, had these newsletters, all the marketing pearls. I went to all those marketing classes, and they, you know, every single pearl they told me, we tried. But guess what? And even open houses we had, and you know, the few patients we had, actually, most of them, this is my son, because we only had like 5 people show up, so had him in there, over there on the lower left. But the one thing about marketing that Barry is trying to touch upon is marketing doesn't build loyalty in your patients. It might get you a little blip. It might, you know, get a couple patients in the door, but over the long run, it's not going to stabilize or grow your practice. Not that it's not important. I figured if that wasn't it, it had to be the cool game room. So we built a nice little cool game room, and it was just me playing, you know, Xbox. So, and of course, quality work is super important. Of course, you have to do quality work, but even that by itself is not everything. So, after my first year in practice, here's how we did. You see that over there? Negative $70,000. But, put my head down, I marketed even more. And I was like, I gotta turn this thing around. And you gotta understand my situation right now. We have a $500,000 loan. I have $200,000 in school loans. So $500,000 from the bank for the practice, $200,000 in school loans. Nobody here has school loans, right? So, I mean, you know, I went to Penn. It was still, I don't know what it is now, but it was about $50,000 a year at Penn. So is it more now? Making you feel bad, right? Sorry, but you know, for me, so now add the 200 plus the 500. Not to mention, I had a horrible interest rate from the bank because all the banks turned me down. Every single bank. I had to go to the student financing unit that gave me the worst interest because all the banks said to me, they're like, "There's no way we're giving you this money. You're gonna be owing us $500,000 in 2 years." Well, guess what? I'm happy to say they were wrong because in 2 years, we only owed $306,000. So the truth is we owed more than that because that's how much the practice was down, not including all our other loans. So we went, you know, we were going downhill quickly. And at this point, you know, I'm going home. You can imagine the stress I'm going under. These numbers, negative $300,000, $200,000 in loans. We still owe the bank $500,000. And luckily I have a great support with my wife and kids. And my wife says to me, she's like, "Honey, don't worry." She's like, think about, you know, you're always going to have the one person who supported you from day one. And you know, she was right. So I called my mom. But not just because I'm a mama's boy, but it's because my mom's actually a dentist. She's a restorative dentist. And my mom had a practice that had a huge interdisciplinary component. She did not market ever. She was a horrible marketer. She was a horrible business person, but she had a very successful practice. And she did it through relationships. She's 78 years old right now and still practicing. She loves it. She accepts no insurances. Still to this day, it's all about relationships. You're gonna learn, that's one of the, you're very lucky to have Dr. Planty here because I work with about a few hundred dentists that refer to us now. And he's probably in the 1% that had those kind of relationship with their patients. So anyway, so what did my mom say? My mom, you know, she gave me some pearls that changed everything for us, which we're gonna talk about today. And it's not marketing pearls, but pearls about life and dentistry. And at first I didn't call her right away because I thought, you know, she's a restorative dentist. I'm an orthodontist. Is it gonna be the same? and it is the same. No matter what specialty you go into, or if you practice restorative dentistry, her points can be used by everybody. So she was able to, after using her tips, we turned things around pretty quickly. And we had patients that would come into our office that were not even wanting to be there, but their dentist told them they need orthodontics and they weren't, this is the last place on earth they want to be. And using relationships, we changed things around so they would go from here and they would finish and they'd be jumping up and down. So, and then we were able to take this practice with 3,000 square feet and grow it. And here's where we are now. So this stuff does work, this relationship stuff works. But I do, this is where you guys are right now, right? I remember, as I mentioned, when we were learning interdisciplinary treatment in dental school, we had groups and we used to go into groups and it all seemed like it was very optimistic in terms of getting patients to do the right thing, to get them on board with whatever needs to be done, to use all the specialties together to get the best result for your patient. But in private practice, once you get out, suddenly that stopped happening as much. What do you guys think is the #1 reason that patients don't accept the ideal treatment plan in private practice? Money? What was the other one? Money's a big one. There's time, fear, they're scared of pain, there's all these things. But believe it or not, that's not even the #1 reason. The #1 reason that your patients will not accept the ideal treatment plan is because you won't offer it. I belong to a big study group out of Arizona, one of the biggest in the country. The doctor's name is Frank Spear. You'll hear his name as he's just like Dr. Pankey, very well-known names in the community, in the world. And he polled his audience at his interdisciplinary study club, and he asked them, how many of you give the ideal treatment plan from day one? And less than 50% raised their hand in an interdisciplinary study club, where everybody's coming from all over the country to this one section to do interdisciplinary treatment. How come we're not offering the ideal treatment plan? Why are we afraid? So, when you have your patients, whether you're second years now going into the clinic, whether you're 4th years going into private practice, or 3rd years currently in the clinic, when you first meet a patient, we're all about trying to build trust with them, right? We don't want to scare them. And that was one of the things somebody said, fear. And they're looking at us, and we're worried that if we tell them what they really need, they're going to get frightened and leave us, especially more so in private practice than in the clinic. We're worried that they think that we're trying to pad our wallet and buy the next big car. We don't want them to think that we're greedy, and that's the reason that we're offering all these treatment plans. Thank you for letting us use your car. Yeah. So, what we do when we get out often is we don't offer the ideal treatment plan. We kind of do little bits, hoping that after we build a relationship with them, a year down the road, maybe later, then we could start offering them what they really need. But can you imagine if you went to your physician and you had some blood work done, and you came in for the results, and they only told you a quarter of what was found, and then a year later they told you everything? So that's crazy, right? But in the dental world, that's the way it's being practiced out there. We're too scared to offer the whole plan. And you know what? I was guilty of that too. So back when the practice was hurting, Gina walked through our door. And can you guys see this okay? Can we dim the lights a little bit, or can you guys see that all right? Yeah, okay. So Gina walked through the door, and if you could see, one of the things that Gina had was this cant. Her upper jaw was tipped a little bit to one side. And I'm looking at our numbers, and this is, at the time that we're really hurting. And I really need this case, because we're not having too many cases walk through the door. Because we have this, as I mentioned, 3,000 square foot office, and this is what it looks like at 3 o'clock in the afternoon when she walks in, and she's like, "Are you guys open?" You know, and you know, we're like, "Oh yeah, you know, we're just this is our slow time." You know, if you guys know about, if anybody here has had braces, you know, 3 o'clock in the afternoon for an orthodontist, it's supposed to be packed. Like it's like a party in there supposedly, but not in this office. So this is the way it looked, and I'm freaking out. And Gina, you know, I'm looking at her teeth, and I know that she actually needs interdisciplinary treatment. She needs to have some perio, some surgery to level everything. We can't, if we just straighten those teeth out, it's not going to look great. So I have a treatment coordinator. She's the one that takes Gina to the back and kind of goes over what she wants, and then comes to me to present what the patient wants, and I tell her, you know, what we're going to do. So Terry, my treatment coordinator, comes back to me, and she said, Gina just wants her teeth straightened. I was like, well, we can't, you know, she needs surgery. We got to do all this treatment, and you know, we got to do surgery. But in the back of my mind, I'm thinking, I really need this case. You know, I'm really nervous. I'm going to say surgery. She's going to run. Well, Gina doesn't want surgery. She just wants that space closed and those teeth aligned. Well, she's worn down her incisors. She needs veneers. It's not going to look good if I just straighten those teeth. I can't, you know, I got to do the right thing. Well, Gina wants to pay in full and start today. Well, who might be so judgmental, right? So I'm like, let's start her up. And we did that. So we took Gina and we straightened her teeth. So you see, it looks pretty good there. Went from here to here, from here to here. And here's her face. It went from here to here. And it looks great, as long as she doesn't turn her face. And then it looks like that. Now, this is one of those situations where you just want a patient to move away. And hopefully, you know, not see them again. Because I know that I didn't do the best thing for Gina. Yes, she did reduce my debt, you know, from $500,000 to $496,000, but it wasn't enough. You know, Gina never referred another patient, and I did. In fact, it's funny because I saw Gina a couple years later. She didn't move away because I saw her at the local ShopRite and in the produce aisle, and I'm kind of going picking up my bananas, and I see Gina, and I'm like, oh no! And I quickly put in the cart and do one of these, like my head down and try to run away. But she caught me, and she's like, Dr. Siegal, you know, and you know, she was still a very sweet lady. She never got upset at me. She was with a friend, and she's like, I want you to meet Dr. Siegal. He's the one who did this for me. So this is what's going around town now, and this is the work of Siegal and I at Orthodontics. You know, did I give her what she wanted? Absolutely. I gave her exactly what she wanted. So what was my mom's first pearl? Don't just give them what they ask for. It's funny because we're in the clinic. Aren't we told to take the patient's chief complaint first, like figure out exactly what they want? And my mom's telling me the opposite. Don't just give them what they ask for. Help them discover what they want. What do you think she means by that? In the next, for the first years, you know, for the next several years, and for those of you who've been through all this education, all the stuff you're learning now, all these exams, is there any way that these patients have as much knowledge as you to know what we can do for them? Gina had no idea what was possible. You're going to have patients come into your office or in the clinic telling them what they think you should do for them. And I'm not saying don't take the patient's concerns and their wants into account. Of course you should. Of course you should hear their chief complaint. But we have the knowledge, and we need to be able to educate them to help them discover what they really want, what they never even realized was possible. And with interdisciplinary treatment, you're going to see some pretty cool cases in how we do that. Because you're going to have situations, you know, we talked about Dr. Pankey, he never treated a tooth. This occurred right down the street from me. Patient fractured his tooth. He asked the dentist to fix it. And she used the best lab technician, one of the best in the country, right? We have to say that. Amazing proportions, you know, and the lab technician, I spoke to him after, he's like, I didn't even feel good about this. In fact, I gotta show you this case, but perfect proportion crown, And it looks great if you just see it right there. But if that tooth is attached to a face, and here's the way the patient walked out of that office. So now that perfect crown sticks out like a sore thumb, right? There's so many other ways this patient could have been treated to look better than he does right here, but the dentist simply listened to the patient. He told her he just wants his tooth fixed. She did what he said, but that's not holism, right? So, Dr. Blasky.
Okay,
you're up.
so, as, you know, as Russ is speaking, as Ross is speaking, millions of thoughts are going through my mind, just as he's speaking, millions of thoughts are going through your mind. But the thoughts that are going through my mind are probably a lot different than the thoughts of your mind. I want to stop and go back for a couple of things, because as we were going through the slides, we were going through certain points, when he called his mom and had a discussion with his mom. And so his mom's a little bit older than me, but we started playing with a word. And it became important. And I want to make another point. Language is very important. Semantics is very important. And stopping and thinking about the distinctions between words is very important. So the word need versus want. Okay? There's a big distinction between give the patient what they need, which, by the way, is a very noble philosophy. It's what you're being taught, right? You're in dental school, would you say? I mean, I can't argue. It's the high road. So we worked on that for a while, and we came up with a language of help them discover what they want. Help them discover what, that is so important. Okay? Now you have a co-diagnosis going on. That's a good word, co-diagnosis. You're learning here how to diagnose, but in reality, it's co-diagnosis is what we should be doing. And I found success that way, and that's pretty much what the advice is. Because when you have and it's an attitude really of giving them what they need, that's a whole different approach to patients. And we see it all the time. You need this. You listen to me. University of Oregon, Chip Kelly. You'll do what I say. Versus, let's sit down and talk about this. Find out what you really want. But the problem is, finding out what they really want, it takes work. It takes patience. It takes time to sit down. It takes time. It takes time in a world where we're being forced to compress everything into smaller units. People are complaining about, you go to a doctor, you get 7 to 10 minutes with your doctor and then you're out. But that doctor needs more to make a diagnosis. Same thing's going to happen in dentistry. So let's talk about David for a second. Okay? So I go to the gym a lot. And so I meet David in the gym. And we become fairly good friends. He's not a patient of mine. And every day he says to me, I hate it. I just had this done. I absolutely hate it. And I would tell him, David, come on over. We can get it fixed. So I have an idea of what's wrong with that. He thinks it just looks good. And so after about 6 or 8 months, he finally shows up. So let me tell you a little bit about my practice. My practice is a small practice. We built it in around 2000. And since that time, my son, we'll plug Josh here a little bit. Okay? My son is a laboratory technician that Ross was speaking about. He's very artistic. And he didn't know what to do with his life. And he wasn't as smart as all you guys. He didn't do good in physics and math in college. And so he didn't know what to do. So I said, why don't you go work in a dental laboratory? Well, he went to work in a dental laboratory, and he liked what he did. And so he's a perfectionist also, like a lot of us. And so he worked in a dental laboratory for about a year, and then he began to hate the mundane work that he was doing. And so I said, well, get you to a better laboratory. And so we sent him down to Atlanta, where he worked for my lab at the time, and he learned more. And then he went to work for a technician in Chicago by the name of Olivier Trick. Olivier Trick is probably one of the top 10 technicians in the world. Directly studied under Willie Gello, who you probably know. And so he worked with Olivier for 2 years. He worked with an apprentice. He worked as an apprentice at the feet of a master for 2 years. But he had no degrees. So then he spent 3 years at UCLA working with Dr. Ed McLaren and Sasha Jovanovich in the implant department at UCLA. At which time he came back and we opened up the laboratory in my office. So I have the advantage of having an in-house laboratory with, I hate to use the word master, but in the local community, he is a master, okay? And by the way, he took this journey. Josh is now 36 years old. All of this has been done over the last few years. He speaks internationally. He's probably spoken in the country of most of your origins. He's spoken from Japan all the way to wherever. And so this is David. He also became good friends with David. And we took some photographs. Are you already photography, Nelson? No? A little bit? Okay, so we'll talk about photography at the end of this presentation. It's an important skill. It's an important skill. And so Josh is a master at photography. We took some pictures. We showed him, we showed David what was wrong here. That's where he was. And so, and by the way, during this whole time, I was on the phone with the dentist and the surgeon who actually placed the implant and they made the crown. I offered the dentist to come over and at no charge to use my office with my lab to go ahead and redo this. She didn't want it. She thought it was fine the way it was. The patient had been complaining and complaining. And so we took it out and took a look at the abutment. I mean, we remade, that was what was there. We lasered the tissue back. We made a new abutment. This is just his work. We made a new abutment. We made a new crown. We went from that. Form is very, by the way, I meant to say this earlier. From a restorative standpoint, one of the most difficult things a restorative dentist can do is a single central incisor. A single central incisor is probably one of the most difficult things you can do. We recontoured the tissue with these photographs, made the new crown, and David went from this to this. This was about 4 or 5 years ago. That was about 4 or 5 years ago, and David has become a regular patient, a big referrer of patients. I mean, this is marketing. And it all started where? In the gym. It all started where? In the gym. They sold out that I go to Bikram Yoga. Okay, so I'm part of the Bikram Yoga community in Cherry Hill. I would say that maybe 30 patients, new patients have come to me through that community. So get out there and meet people, talk to people, have conversations with people about their teeth. Everybody know that's Dr. Amsterdam? No, they know Dr. Amsterdam? He was a god when I was in middle school. Yep, okay, right here. And so, and he's basically, he is the Dr. Pankey of University of Pennsylvania. His students, for years, didn't he just pass away over the last 2 years ago? And what he was famous for saying is one diagnosis, many treatments. So what does that mean? What does that mean? One diagnosis, many treatments. We have got to make the diagnosis first. We've got to know how to diagnose everything, the whole picture. The example that Ross used in his case was about holism. about all of it. It wasn't reductionism. It wasn't reducing it down to one tooth or one thing, making it look better, just fill it, done. It's not looking at the whole picture. However, the conversation begins with the many treatment plans. That's what discovering what people want really means. That's reductionism. The practice of simplifying a complex idea, issue or condition or the like, especially to the point of minimizing, obscuring, or distorting it. It went by before when you took asking the question about that Frank Spear said about
How many of you guys would give the ideal treatment plan on the initial consult?
what's the major thing that stops you? And his answer was that you don't give the whole treatment plan. You see? So, and the reason somebody said about why don't patients accept the dentistry? And somebody said money. Well, there are basically 5 objections to dentistry. Money and fear, they run close 1-2. The third one is no sense of urgency. The fourth one is no time. And the fifth one is no trust. So with all of these, and by the way, those are the only 5 reasons people don't choose the intervention. What's the antidote to all of them? Trust. When people trust you, when people buy you, they will buy your intervention. But they gotta buy you first. That's the key. And so the answer to why people don't accept it is, yeah, partly that they're not diagnosing it, but also that they don't trust. This is Maslow's hierarchy of needs. Abraham Maslow was a psychologist from the 50s and 60s, and he developed this hierarchy of needs, and it affects every one of us. And you can look it up at home and see what it is, but basically it's a scale of maturation, where we are in our own lives. And most of us enter the world in our lives needing food, clothing, and shelter, the physiological needs. And then eventually when we all can eat and have a few bucks in our pocket, we talk about safety and security. And then we go to love and belonging. And we basically go through this hierarchy. See? When I graduated dental school, don't get jealous now, my total loan was $25,000. I know it's tough. I know it's tough. And I know that number for each and every one of you is going to keep you in survival for a significant amount of time. It's going to take more courage than it took me to get out of it. I can tell you. That's why it's easy for an old guy to sit here and tell you this stuff. I get that. And truthfully, I feel for you. I do. I do. Not because you won't get the money. Not because you won't ever get out of stuff. I wish you will. But it's going to take a lot more confidence in yourself than you could have been. See? And that's hard. Because where you're going on that journey is right there. To be who you are, to be the person you meant to be when you got there. Self-actualization, to become who you were meant to be. And a lot of people don't get there for various reasons. And today it's tough. It's tough for the millennials to get out. I acknowledge that. That's why I go out and speak. That's what I was telling Ross. I come here to speak to young people because this pisses me off. It pisses me off that you owe this kind of money and you're going to go into an environment where you can't make a decision. And that's why I'm here. And if 1 or 2 of you hear this message today, that's fine. Passion. Anybody want to tell me what passion is? It's a metaphor. Passion is a metaphor. It's a metaphor for fire. It grows, and grows, and grows. How many of you have passion for dentistry? I suspect every one of you will. I suspect every one of you will. Because if you don't, that's not good. And if your father was up here, he would say, you better raise your hand. I spent all my money getting you here. You have sunk costs. If I ask the same question to the same group 5 years from now to raise your hand, how many of you have passion? The answer is not going to be the same. Because passion grows like a fire. What's the opposite metaphor of passion? Burnout. One of the most prevalent things in dentistry and medicine today is burnout. The exact opposite of passion. And it happens over time. Happened to me. Okay? So what is passion? It's a formula of A plus C plus R. A is autonomy, which I'll explain in a couple seconds. C is competence. And R is relationships again. See? So I have this phrase I use. Passion is a byproduct of mastery. It's important that you devote your careers to becoming masters. It's just not a saying. It's your life is at stake. Your life is at stake because that's what's going to keep the fire burning, your mastery. Years ago, I took a Peter Dawson course. Anybody Peter Dawson? Took a Pete Dawson course. And the first thing Pete said in that room was, I'm going to teach you a level of understanding of dentistry that you've never even heard of before. I caught the fire. Listen to my metaphor. I caught the fire. I started to learn dentistry at a deeper and deeper and deeper level. And that's what kept the fire burning. You see? But if you only understand dentistry at the level of a dilettante, at a very superficial level, burnout. It's coming. Prepare for it. So what is autonomy? Autonomy is having control over your day. Control over your time. Doing what you want to do every single day without somebody standing over your shoulder and telling you, do this, don't do that, you have 20 minutes. That's not autonomy. That is not autonomy. And you will never master this profession without a level of autonomy. It's one of the reasons why I remain a fee-for-service private practice dentist. I can tell you, when patients would come in and ask for things to be pre-authorized, and we would do it gladly for them, you see? By the way, let me clarify some terms. I don't accept insurance means I will accept their insurance through their paperwork, but I'm not on the list. Okay? So yes, we would pre-authorize. And then we get a phone call back from the insurance company to explain what I wanted to do. I can tell you there's been no lower moments in my life than talking to some girl at an insurance company, explaining what I wanted to do for a patient and justifying it. That's not autonomy. You don't want to be this. That's frustration. See? You will.
Come up. You want to say anything else?
No. I'll discuss competence and relationships later on. Okay?
No. It's 12:11 right now. Let's take a 10-minute break.
Yeah, no other questions?
Oh, any questions so far? About anything? We're going to get into the meat and potatoes of clinical cases because we talked about the first pros. In order to help them discover what they want, you guys need to know what is possible. So we're going to go over all kinds of situations of what is possible to transform patients, to treat the whole person. I would, at this point, if you want to just jot some notes down. If there's a specific case you have questions for me at the end, because often I have students come to me at the end and they're like, I can't remember which one it was this case, so. Just, if that's the only thing, if you want to take a note down just to discuss with me certain cases at the end, we'll go over that. We'll take a 10-minute break. If you want to call Legos, this would be a good time, and we'll get a couple of pies. All right?
Shut that off? Is that on?
Yeah, shut that off. So I'll get